Hi, I'm Lexi, and we are all dental hygiene students here at Parkland College. And today we're going to be talking about xerostomia and how it contributes to cavities. Today we are going to explain to you what xerostomia is, how to prevent and treat it, define what cavities are and how to prevent them, talk about gum recession and how it can increase your risk of cavities.
Before starting this video, we want to educate you on a few statistics about xerostomia and decay in elderly patients. Older groups, such as residential and nursing home individuals, have shown to be at a higher risk of dental disease and have high dental treatment needs. As cognitive impairment increases, individuals may experience an increase in tooth loss, dental decay, gum disease, and denture-related problems. In a recent study, 43% of nursing home patients were suffering from xerostomia. And in that same study, 65% of patients had root decay and 68% previously had decay that had been filled.
Xerostomia is also known as dry mouth. This is a condition in which there is a reduction of salivary flow. Some of the causes can be from medications, radiation treatments, or brain trauma.
The signs are constant feeling of thirst, burning sensations, cracking of the lips, tongue, and oral tissues, swelling, and overall discomfort. Some of the implications for your oral health are a higher risk of cavities, gum tissue, and tongue irritation, and lack of taste sensation.
If you take a look at the photo of this person's tongue, you will notice the left side looks normal. A healthy tongue should remind you of a carpet. You should be able to see all the little grooves and cracks on the tongue. If you look at the right side of the tongue, it is red and angry looking. It is inflamed and painful. This is what xerostomia or dry mouth can do to your tongue.
Some of the things you can do to prevent and treat xerostomia are suck on some sugar-free candies, use an alcohol-free mouth rinse, sip on water regularly, limit or stop tobacco use, use over-the-counter saliva substitutes such as Act mouth rinse or Biotine, and limit your caffeine intake. Good saliva flow is important for more than just preventing xerostomia.
So now we're going to take all that information that we just learned and put it into action with our patient here. So hi, how are you doing today?
Good, how are you?
I'm great. So after doing an oral examination of your mouth, I've noticed that you've had some dry and cracked areas. Do you want to tell me about that?
So I've been a smoker for 10 plus years, but as the dry mouth and the cracks in my mouth, I'm not really sure what to do about it, but it really hurts a lot, like constantly, so.
Okay, so basically what you have is what we call xerostomia or dry mouth. So you already know what you have, but basically that is just a big reduction in your saliva flow. And saliva just helps prevent cavities, and it can help stop with your burning sensation that you're feeling with your dry mouth. So some things that I can offer you to help reduce that is to stop smoking. Smoking is a huge factor in dry mouth and just really dehydrating that whole area, so you really want to try and quit that. Okay. Another thing that you can do is use sugar-free candies instead of your Jolly Ranchers, because sugar is also not the greatest factor with that. Another thing you can do, which is honestly a pretty cheap version, is just suck on some ice chips. Don't chew on them, just kind of suck on them, so when it's in your mouth it'll melt and help with the hydration of that area. And then last but definitely not least is something that I would recommend using is a Biotine mouthwash. So here I have a sample of some Biotine mouthwash if you would like to use it. So basically this just helps relieve your symptoms for up to 4 hours, and it's alcohol free, which is also big.
Awesome, thank you. I'll
Yes.
give this a try.
When foods with carbohydrates sit on the tooth, cavities can develop, causing decay and pain. Some examples of carbohydrates are bread, cereal, milk, soda, fruit, and candy. Bacteria in the mouth then turn those carbohydrates into acid. The acid dissolves the enamel, creating cavities.
Stage 1 is where decay is only in the enamel. Stage 2 is when the decay has become larger in size and has almost reached into the dentin.
Stage 3 is when the decay has reached the dentin and is approaching the pulp of the tooth. And finally, stage 4 is when the decay has reached the pulp and potentially has access to your nerve.
This is an equation we like to use to explain how cavities form. Sugar from bacteria or carbohydrates feed bacteria, and this causes acid. So sugar plus bacteria equals acid. This acid that is then created reacts with a healthy tooth and causes decay. So acid plus a healthy tooth equals decay.
So next we're going to be talking about gum recession. When your gums recede or pull away from your teeth, this is called gum recession. This can happen to people of all ages. Gum recession can be caused by brushing your teeth too hard or using a hard bristled toothbrush. This can also be caused by smoking tobacco products, trauma to the gum tissue, and if partial dentures do not fit correctly. Some dental problems that can result from gingival recession are root exposure, which could lead to tooth sensitivity, and since there is not a protective factor on the root surface, this could lead to cavity formation on the roots. Some treatment options for gingival recession would be to lighten your grasp and apply less pressure when brushing, and also switching to a soft bristled toothbrush because it can help to reduce your risk of recession. Also, if you wear a partial, make sure it is stored correctly when not being worn to ensure that there are no shrinkage. If recession is already present, in order to prevent sensitivity or root cavities, use a fluoride toothpaste and/or a fluoride mouth rinse to help keep your root surface mineralized.
Saliva contains many protective factors such as calcium and phosphorus, and this is the mouth's biggest defense against pathogens and decay. Saliva helps to remineralize teeth from early decay and clears the mouth of food and debris. It also buffers acid formation and contains antimicrobial proteins. This helps to combat negative bacteria in the mouth.
Now that we've discussed what causes cavities, we're going to discuss how to prevent them. One of the most important things in preventing cavities is the removal of plaque. One of the things that you can do in removing plaque is brushing twice a day with a soft toothbrush and a fluoride toothpaste. The proper way to brush your teeth is to take your soft toothbrush and angle it at a 45-degree angle against the tooth. This angle allows the bristles to get underneath the gum line and remove the plaque from these areas. You'll use a back and forth, soft and slow stroke against each surface of the teeth. Another way to remove plaque is to floss daily. Flossing removes bacteria and plaque from underneath the gum line and in between the teeth where the toothbrush can't reach. The proper way to floss is to hold the floss in a C shape against each tooth and to move gently up and down in between each of the teeth. There are some other things to use in case you're unable to hold the floss thread. There are floss picks or floss handles, or there's also an option of a water flosser which uses water instead of thread. Getting sealants placed on the biting surface of the teeth without any fillings can also prevent cavities. The sealants prevent bacteria from getting into the grooves and the pits of the teeth. Another way to prevent cavities is chewing xylitol gum or sucking on xylitol candy. The xylitol helps keep the mouth clean and helps keep the pH high and prevent demineralization of the teeth. As we discussed, xerostomia is a big factor in causing cavities. If you or your patient has xerostomia, there's a product called biotin that you can use. This has mouthwash, a mouth spray, gums, mints, or toothpaste. All these products help keep the mouth moist and help healing and keep the inflammation down, along with preventing cavities.
And it's important to know all this information yourself so that you can educate your patients. Thanks for watching. We hope you found this educational for both you and your patients.